Hi, hello everyone, this is Dr. Khan. This is my second Facebook Live. And so a very interesting patient in her 60s. So she had her first set of implants in 1990, so that is 34 years ago. And then she got an imaging study in 2016, that is 26 years later, that showed that the right implant was indeed very much ruptured. This was a silicone implant that she had in 1990. In 2019, 3 years after, she got what was a replacement of the implant with another second set in 2019, 3 years after the imaging showed that she had a rupture. So when the surgeon went in and replaced, there was free floating silicone on the right side. And in 2019, she got her second set of silicone implants. Now she comes to me, status post what is a dog bite that occurred in 2023 last year, and there was concern that there was quote infection, trauma, whatnot else as a result of the dog bite to the right breast area, right chest. And she then subsequently got a MRI which showed what is an effusion, which is a small amount of fluid around the implant / capsular tissue. And the concern was this is a result of a dog bite. When I put the two and two together, my thought process is this is the leftover silicone from the 2019 surgery that was done where the silicone spilled into the chest, and that residual silicone basically caused this effusion, and it was not necessarily the dog bite because the patient did not have an active infection. So as we go in, the MRI shows that the implant is very much intact. And remember, if there is any infection, any involvement of the implant, it certainly should show up as potential rupture. And we will find out. And this is the whole goal. The goal is to remove that entire implant capsule and that small amount of effusion, that's that fluid swelling, all contained so that none of it spills out. Now we will find out if this is a dog bite with a concealed infection, or is this that history of the silicone fluid rupture that was present from before. The MRI did not show any silicone pockets within and around this implant, which is intact. So hopefully this makes sense. And so we'll see as I cut out now. The patient had a grade 4 contracture on the right side, which was picked up on the MRI. And as you can see, the entire implant capsule has an irregularity to it. It was done en bloc, complete en bloc, 9/4/24. And I cut out the excess skin, as you will see right here, full thickness to help with the aesthetic contouring. And you can see that scar tissue. So going back to this implant, you will see this is all encased. Whatever the internal contents are preserved, and we will see if there's any fluid or not. What I'm going to do is, Flamor, can you do me a favor? Can you empty that basin and give that to me? So what I'm going to do here is I'm just going to get a container so that in case there's any fluid, I'm going to basically have it be contained because I want to be able to send this off to cytology, because remember the MRI is showing that there's some fluid in the inside. And you can see the other thing I want you to notice is look how thin this capsule is. It's so thin you can actually see the implant. So what I'm going to do is I'm going to go ahead and put this here, and I'm going to go in from the top. Now these are implants from 2019. All blood loss was minimal, like 5 cc's each side. It is smooth, silicone appears intact. You can see how hard this capsular tissue is. Some areas are very thick. Some areas are very thin. So what I'm going to do here is I just want to go ahead and cut in this direction, if you will. And as I go in, you will see, look how thin it is. You can see the scissor right here. So I'm going to cut into this area. And now I'm going to gently peel this out. You can see, look. See the fluid? Just like the MRI said, there's some trace fluid here. I'm going to go ahead and, there's not much here, intact implant, which the MRI is correct. And so there's some fluid, you can see on the inside, but not enough to send to cytology. And as I go in, I'm going to go ahead and cut this open. Indeed, there is, what is that trace fluid? You can see how shiny it is. You can see, look at this, small amount of discharge. And this might be part of that silica that ruptured silicone that's all embedded within the soft tissue. None of this fluid ruptured, and you can see, look, I'm going to go ahead and now, there's no point, there's no fluid. I'm going to go ahead and put this here, and you can see, look at the ruler, how paper thin this is. See how paper thin. No matter how thin it is, it can be still done en bloc in a very controlled, contained, calculated way, such that none of this few drops of fluid, maybe a couple drops, would spill into the chest. And so the other thing I want to show here is, if I go like this, there's some granularity to this. You can see, look at these pecs, and some of these are crystallizations, if you will. Look at this that's falling off. And all of this was contained. None of this, quote, spilled into the chest, and that's the whole. No matter how thin, look and see my blue glove. So I'm very happy and content with how the whole dissection has gone. And this is your, and you can see some fluid, water droplets, or excuse me, droplets over here. Allergan 310 cc's. You can see some fluid, the scant amount that was present on the. I'm going to change my top glove, and I'm going to go over to what is a grade 3 contracture she had on the left side. And as I lift up, you will see completely done in en bloc fashion. You can see some irregular abnormal tissue. Now what's interesting is, look, she had on, this was sitting on her left chest, and this area was protruding out. This is the pointy on the left upper outer side. And so this point, as you can see, was part of that contracture, and you can see there's actually like a line in the middle. So I'm going to show you, and I'm going to cut. You can see how saran wrap thin this capsular tissue is, and all was done in what is the en bloc fashion. So I'm going to go ahead and cut this open, and according to the MRI, it's an intact implant. And as I go in, I want to see, let's look at this, so saran wrap thin. See how this tissue is sitting? And I'm actually going to show you how it was. Where it was folded up like this. You can see the line in the middle, like the equator, if you will. And it was like this, protruding out. And you can see this is your Allergan 310, very small amount of fluid as well, not uncommon to see. And you will see again the very, very thin nature of this capsule, much thinner on this side compared to the other, and very thin, some areas relatively thicker. So overall, I'm very happy and content with how the whole dissection has gone. Grade 4 contraction on the right, grade 3 on the left. En bloc fashion is gold standard. The minimum amount of fluid effusion on the right side was all contained, none of it spilled. As you can see, there is no infection on the inside. This is consistent with, if you ask me, from a clinical history. We put the whole thing together, including the MRI findings, and now having opened this, all suggested, well, what is that residual silicone that was bathing, encasing around? That was all removed, all contained from her 2019 surgery where the implant had ruptured, and it was not done in the en bloc fashion back then. So the implants will be returned to the patient, capsule sent to pathology, rule out the BIAL, CD30 analysis, rule out lymphoma, rule out malignancy, and cultures done for aerobic, anaerobic, and fungal. And we will see how the patient bounces back with her symptoms of breast implant illness. And there you have it. This is Dr. Khan, Executive Plastic Surgeon.